Hey there, if you're watching this, chances are you have an elderly parent, grandparent, or loved one, and lately you might be feeling a bit concerned. Maybe something seems a little off, but you're not quite sure what it means. You're not alone. Aging is a natural process, but certain changes in behavior, memory, or physical health can be early signs that an older adult might need more support than they're currently getting. Whether it's forgetting to take medication, neglecting hygiene, or withdrawing from social interaction, these signs often sneak in quietly. In this video, we're going to walk you through 10 early warning signs that your elderly loved one may need help, and more importantly, what you can do about it. Stick with us to the end, because understanding these signs can help you act early, prevent crises, and provide the care your loved one truly deserves. Let's get into it. Have you noticed sudden weight loss or gain? Bruises that no one can explain? Or maybe your loved one just seems more frail lately. These physical changes can be signs of underlying health issues or mobility problems. For example, unintentional weight loss might point to malnutrition, difficulty cooking, or even depression. Frequent bruises could suggest falls or balance issues, possibly from muscle weakness, poor vision, or even side effects from medication. What to do? Take note of these changes and don't be afraid to ask gentle questions. A visit to the doctor for a comprehensive checkup is a good first step. In some cases, physical therapy or a home safety assessment can help prevent accidents. We all forget things now and then, but if your loved one is frequently misplacing items, forgetting appointments, or repeating themselves in the same conversation, it could be more than just normal aging. Early signs of cognitive decline or dementia often show up as confusion about time or place, trouble following instructions, or difficulty finding the right words. What to do? Keep a journal of these instances so you can track patterns. Encourage a visit to a healthcare provider who can conduct a cognitive screening test. And remember, early intervention matters. If mom or dad always took pride in their appearance, but now seem disheveled, haven't bathed in days, or are wearing stained clothes, it's time to pay attention. Poor hygiene can stem from physical difficulty, like not being able to step into a tub, or cognitive issues where they simply forget. Depression can also be a cause. What to do? Try to understand the root of the issue without judgment. Sometimes installing grab bars, switching to a walk-in shower, or bringing in a caregiver can make a world of difference. Has your normally cheerful relative become irritable, anxious, or unusually quiet? Mood swings, apathy, or increased agitation can signal emotional distress, depression, or even early dementia. Pay close attention to personality changes, especially if they're sudden. These shifts may be linked to medication side effects, chronic pain, or loneliness. What to do? Compassionate conversation is key. Let them know you're there for them and consider seeking support from a geriatric psychologist or counselor. Don't overlook the healing power of companionship and regular social interaction. If you find unopened bills stacking up, expired food in the fridge, or confusion about bank accounts, your loved one may be struggling with once routine tasks. This can happen when cognitive function declines, but also due to physical limitations like arthritis or vision loss. What to do? Step in gently. Offer to help with budgeting, automate bill payments, or even set up a financial power of attorney. Hiring a housekeeper or using a meal delivery service might ease the burden too. Have they stopped going to their favorite club, place of worship, or lunch with friends? Isolation isn't just sad, it's dangerous. Loneliness is linked to higher risks of heart disease, cognitive decline, and even early mortality. What to do? Encourage social interaction in small doses. Look into local senior centers, adult day programs, or virtual gatherings. Sometimes just a weekly phone call or video chat can make a huge difference. Walking into a once tidy home that's now messy, cluttered, or unsafe, that could be a red flag. Hoarding behavior or neglecting household chores might reflect cognitive impairment, depression, or simple overwhelm. What to do? Don't criticize. Instead, offer help with a clear, supportive tone. You can suggest hiring professional cleaners or organizing a spring cleaning day together. Make sure safety is a top priority. Clear walkways and remove tripping hazards. Missing doses, Mixing up prescriptions or not taking medications at all can lead to serious health complications. This can be accidental or due to confusion, memory problems, or financial constraints. What to do? Create a simple system like a pill organizer or a smart dispenser that beeps when it's time to take meds. You can also ask a pharmacist or doctor to simplify medication schedules. Driving requires coordination, memory, and quick reflexes. If your loved one has been in a few fender benders, gets lost on familiar routes, or seems nervous behind the wheel, it's time to reevaluate. What to do? This can be a sensitive subject. Offer to ride along and observe. Frame the conversation around safety for everyone, not just them. Look into transportation alternatives like senior shuttles, rideshare apps, or community volunteers. Sometimes you can't point to one thing, but something just doesn't feel right. Trust that instinct. You know your loved one better than anyone. What to do? Use that intuition as a reason to start a broader conversation. Ask open-ended questions and listen with patience. And don't be afraid to get professional input, whether from a doctor, social worker, or geriatric care manager. So there you have it, 10 early signs that your elderly loved one may need help. To recap: unexplained physical changes, memory lapses or confusion, neglecting personal hygiene, changes in mood or behavior, trouble managing finances or household tasks, social withdrawal, clutter, hoarding, or poor home maintenance, neglecting medication, difficulty driving or getting lost. That gut feeling, recognizing these signs is the first step. Acting on them is the next. And remember, you don't have to do this alone. There are professionals, community resources, and support groups out there to guide you through this journey. If you found this helpful, don't forget to like, share, and subscribe. More content like this is on the way, and together we can help our loved ones age with dignity, safety, and love. Thanks for watching, and take care.